Low pressure, also called hypertension, would seem to be something to strive for. However, for many people, low blood pressure can cause symptoms of dizziness and fainting. In severe cases, low blood pressure can be life-threatening.
Blood pressure can have many different effects on a human body. The common problem is high blood pressure, called hypertension. Another problem is having low blood pressure, called hypotension. Hypotension can be serious and it should be taken care of immediately. Low blood pressure can affect the brain and can be dangerous. Hypotension is often caused by decreased blood volume that is known as hypothermia. There are different reasons why this can happen. Usually there is a problem with the nervous system in the brain.
Although blood pressure varies from person to person, blood pressure reading of 90 millimeters of mercury or less systolic blood pressure, or 60 millimeters mercury or less diastolic blood pressure is generally considered low blood pressure. The causes of low blood pressure can range from dehydrating to severe medical or surgical disorders.
Blood pressure. Water flows with a higher pressure when you connect a tube to a pump set operating in your field or house. Also, the tubes burst open if the pressure is very high. Tube to a pump set.
Symptoms. For some people, low blood pressure can signal an underlying problem, especially when it drops suddenly and accompanied by signs and symptoms such as dizziness or lightheadedness, fainting, lack of concentration, blurred vision, nausea, cold, clammy, pale skin, rapid shallow breathing, fatigue and depression and thirst.
In physiology and medicine, hypotension is abnormally low blood pressure, especially in the arteries of the systemic circulation. It is best understood as a physiological state, rather than a disease. It is often associated with shock, though not necessarily indicative of it.
Systolic pressure, the first number in a blood pressure reading. This is the amount of pressure your heart generates when pumping blood through your arteries to the rest of your body. Diastolic pressure, the second number in a blood pressure reading. This refers to the amount of the pressure in your arteries when heart is at rest between beats.
A certain amount of blood pressure is important for the circulation of blood in our body. In low blood pressure, the pressure decreases below the required level, resulting in
Current guidelines identify normal blood pressure as equal to or lower than 120 to 80. Many experts think 115 to 75 is even better. Although you can get an accurate blood pressure reading in any given time, blood pressure isn't always the same. It can vary considerably in a short amount of time. Sometimes from one heartbeat to the next depending on the blood position. breathing rate, stress level, physical condition, medication you take, what you eat and drink, even the time of the day. Blood pressure usually lowers at night and rises sharply on waking.
In an adult, as we know, 120.
Medication that causes low blood pressure. Diuretics, alpha blockers, beta blockers, drugs, Parkinson's disease, drug like sildenafil, particularly in combination with the heart medication, nitroglycerin, certain types of antidepressants, for example, tricyclic antidepressants.
Here is from www.makemegenius.com. If you want to see more science videos, go to
Risk factors. Low blood pressure can occur in anyone. Thought-centered types of blood pressure are more common depending on their age and their factors.
And I was told that my blood pressure was 115/75. So I thought we would talk about exactly what this means and try to figure out how to think about blood pressure and using these numbers and this experience as kind of a long-term thing. So the way I think about blood pressure is I always imagine kind of a
Complication. Even moderate forms of low blood pressure can cause not only diseases and weakening, but also fainting and risk of injury from falls. And severely low blood pressure from any causes can deprive your body of enough oxygen to carry out of this normal function, leading to damage to your heart and brain. For example, in the video we can see the food that we can eat if we have a high level of blood pressure. This helps to decrease the blood pressure. Test and diagnosis. The goal in testing for low blood pressure is to find the underlying cause. This helps determine the correct treatment and identify any heart, brain, or nervous system problem that may cause lower than normal reading. For example, blood pressure test, blood test, electrocardiogram, echocardiogram, stress test, Valsalva manure, and chill table test. In the video, we're going to see how takes blood pressure. To measure and
The
record
next
blood
skill is
pressure.
to take a blood pressure.
Treatment and drugs. Low blood pressure that either doesn't cause signs or symptoms or causes only mild symptoms. If you have symptoms, the best treatment depends on the underlying cause, and doctors usually try to address the primary health problem.
Hypotension is physiologic state of abnormally low blood pressure.
Use more salt,
Systolic blood
drink
pressure
more
less than
water,
90 or diastolic
wear
less
compression
than 60.
stocking,
Then
medications.
hypotension exists. The main symptoms of hypotension are lightheadedness or dizziness. If the blood pressure is sufficiently low, faint